Hello, this is Dr. Grande. Today's question is, what is the difference between borderline personality disorder and the concept of complex post-traumatic stress disorder? So borderline personality disorder is a mental health disorder in the DSM, and complex post-traumatic stress disorder is not, but has been proposed to be a disorder in the ICD, which is another manual that's similar to the DSM. So I'm going to go over some of the elements we see with C PTSD and then look at some of the areas of overlap between C PTSD and borderline personality disorder, and then some symptoms that we really only see with borderline personality disorder. I'll also talk about some of the different theories about the relationship between C PTSD and borderline personality disorder, like the idea that C PTSD should replace borderline personality disorder, or C PTSD as a subtype of borderline personality disorder. So first, let's start with the concept of C PTSD. So with complex PTSD, we see really all of the same symptom criteria as we see with PTSD, except the trauma is conceptualized as complex trauma. So a trauma that occurred repeatedly, usually in someone's childhood, as opposed to one single event. We also see a few other characteristics that are associated more so with CPTSD than PTSD, like emotional regulation difficulties, with anger and areas of sensitivity, with dissociation, and again, of course, this occurs with PTSD, but it's considered more severe in CPTSD. Difficulty with self-perception, like shame, guilt, a negative concept of self, a distorted image of the perpetrator, so a preoccupation with revenge or focus on that relationship with the perpetrator, interpersonal relationship difficulties like distrust and isolation, and of loss of meaning like hopelessness. So when we look at the areas of overlap between CPTSD and borderline personality disorder, we see a number of symptoms. We have mood dysregulation, a feeling of emptiness, loneliness, increased sense of guilt, increased difficulties with anger, and decreased self-worth. So some characteristics and symptoms we see with borderline personality disorder that we don't typically see with CPTSD, or we don't see them to the same extent, would be the self-harm and suicidal behavior component with borderline personality disorder, the attempts to avoid abandonment, the fear of abandonment, paranoia, impulsivity, the love-hate cycle that we sometimes see with borderline personality disorder, idealization and devaluation, and the unstable sense of self. Now, with CPTSD, there is a negative sense of self, as I mentioned. But with borderline personality disorder, we think of it more as an unstable self-concept. So somebody with borderline personality disorder could have a negative self-concept one day and a positive self-concept the next. So really, the unstable component makes it a bit different than what we see with CPTSD. Now, in terms of the treatment of borderline personality disorder versus CPTSD, the treatment is actually quite similar. There are some differences. With borderline personality disorder, there's more of an emphasis on decreasing the dependency on other people and improving the stability of the sense of self, as well as avoiding self-harm and suicidal behavior. With CPTSD, we see more of an emphasis on decreasing social avoidance, interpersonal avoidance, creating a positive self-concept, and restoring a sense of power and control, so empowerment. So with all these similarities between borderline personality disorder and CPTSD, and some differences, there's a lot of controversy over what the relationship between CPTSD and borderline personality disorder is. I'm going to go over a few of the popular points of controversy. So one is that CPTSD should replace borderline personality disorder. So with this theory, borderline personality disorder never should have been a mental health disorder, and this whole time along, it was really CPTSD. So in essence, the group that believes this is saying that CPTSD better explains the symptoms than does borderline personality disorder. Now, I can appreciate many of the elements of this argument, but there are some difficulties with it. And the primary difficulty of this argument is that trauma is considered etiological for both borderline personality disorder and C PTSD. It's fairly easy to see how it could be etiological for C PTSD, complex trauma. It makes sense that complex trauma could lead to the symptoms we see with PTSD, and evidence tends to support that. Now with borderline personality disorder, the story is quite a bit different. Many individuals who have borderline personality disorder do have a trauma in their history, and a lot of times that is complex trauma. However, about 10 to 20% of individuals with borderline personality disorder have no trauma history at all. Also, we know that with borderline personality disorder, there's a substantial genetic component. It's heritable. 42% of the variants in the symptoms of borderline personality disorder can be explained by genetics. That's a substantial portion. Another part of this argument with C PTSD replacing borderline personality disorder has to do with comorbidity. And here we're using figures with PTSD because, of course, C PTSD is not a mental health disorder. So with individuals who have borderline personality disorder, 58% of those individuals would also qualify for a diagnosis of PTSD. Now that's a large percentage for certain. However, 86% of individuals with borderline personality disorder would also qualify for a diagnosis of major depressive disorder, 62% a diagnosis of substance use disorder, and 54% a diagnosis of one of the eating disorders. So we see a lot of comorbidity with borderline personality disorder, not just a strong relationship with PTSD. Another theory as to the relationship between CPTSD and borderline personality disorder is that CPTSD is a subgroup of borderline personality disorder. And this subgroup is a way to better understand individuals with that particular grouping of symptoms. Meaning if we use CPTSD as a subgroup of borderline personality disorder, it would inform treatment because that subgroup is distinct. Not distinct enough to warrant an independent classification, but distinct enough to include under borderline personality disorder to offer some treatment that's specialized. The last theory we see is that CPTSD is distinct from borderline personality disorder, and that we need both mental health disorders. We need both classifications available. The main argument here is that the treatment is substantially different. The needs for individuals that have CPTSD are greatly different or substantially different than the needs we see of individuals who have borderline personality disorder. This is a bit of a controversial issue, as I mentioned, and if you look at the literature, you see a number of opinions. Some individuals believe that we don't need CPTSD at all. Others believe it's an interesting concept that we should continue to study and it can inform treatment. And still others believe that it must be a distinct construct. There are a number of other beliefs as well. So with all this evidence and all these different interpretations, what do we do with this relationship between CPTSD and borderline personality disorder? And the short answer is, I don't know, but I'd like to see continued research. I think when I look at all the research and I weigh it together, I am convinced that CPTSD is distinct. I'm not sure it's distinct enough to be its own classification, but I can certainly see that argument. And I think I lean more toward that argument than this idea that we shouldn't have it at all, or it's a subtype of borderline personality disorder. And I certainly think that the argument that CPTSD is distinct from borderline personality disorder is a stronger argument than the idea of CPTSD replacing borderline personality disorder. So I'll be interested to see what further research reveals about these two constructs. In the meantime, it's important to remember that just because CPTSD isn't a separate mental health disorder right now, and it may never be, it doesn't mean that the symptoms that we see with CPTSD can't be the focus of treatment. If an individual comes into a practice or an agency and they have PTSD and they also have symptoms of CPTSD, the treatment plan and the therapy can address that. Similarly, if somebody has borderline personality disorder and they also have symptoms of CPTSD, a treatment plan can be designed to address those issues. So we don't necessarily need to get hung up on what is or is not a mental health disorder. Of course, classifications are important. What's more important is we're providing good treatment and addressing the symptoms and the goals of the clients that we treat. I hope you found this description of borderline personality disorder and complex post-traumatic stress disorder to be interesting. Thanks for watching.